Hello, everyone. Thank you for joining us again on another episode of DEIB Small Talk. If you are just joining us for the first time, I want to say thank you. Welcome to joining our live show. DEIB means diversity, equity, inclusion, and belongingness. And it's just small talk for us to talk about current trends that happen within the DEI and workplace. Today I have with me a new topic, an interesting one. I can see a lot of people there've been discussions going around, conversations around today's topic, and it is DEI in public health. We're going to be looking at how we can strategize towards a balanced and healthy mental health. So today we'll be talking from different perspective. We want to look into DI in public health sector, but we also want to look into mental health itself and see ways that we can achieve not just a balanced mental health in today's toxic workplace, but also an healthy one. I have with me three amazing speakers, all black women. Yeah, I can see some people screaming over there. And they are all women of excellence. But before I bring them to introduce you to them and them to us all, I want our audience to tell me where you are joining us from. Tell us where you're joining us from. Let's see who we have on the midst. I can see a lot of people already throwing some likes on LinkedIn, but tell us where you're joining us from. I can see Abayomi joining from Nigeria, Lagos, Nigeria. I'm waiting on for more audience, more listeners. Tell us where you're joining from. Tell us where you're joining from. And that reminds me, before I even go into the audience, I see there's some comments I saw on our three speakers channel, which I'm going to talk about, especially in Ngozi. I saw some funny comment and I was like, yes, yes, people are really eating it on. But let's see, I can see someone else. Okay, Jane from Kent, Washington. Selena, thank you. Welcome. Thank you for joining us. Not to take much of our time, let me introduce our speakers to you. Yeah, we see we have three amazing speakers, like I said, all women of excellence, Black women of excellence. That's what I like to call it, and the Black Women series. I have with me Olubukunola Oyedele. I have with me Ngozi, Cadmus, and Deborah Oluwashina. And while I'm going to introduce them one after the other, I want you to get to know more about them. We have a profile to read. And that's one thing I enjoy. So this is good. This is Olubukunola Oyedele, who is the director of system epidemiology and education. That's quite a mouthful. Okay, let's meet Olubukola. Olubukola is a public health researcher with over 10 years of experience in epidemiology, public health education, project management, and mental health research. She's the current director of systems epidemiology and education at 54 Chan, as it's in the United States, where she oversees a team responsible for the collection, analysis, visualization, management, and sharing of of phenotypic and clinical data. Dr. Oyedele has also worked with public agencies, including the Council of Compulsive Gambling of New Jersey and the Austin, New York City, and New Jersey Department of Health. She's a proud graduate of UMich, okay, where she obtained her bachelor's degree. She also received her MPH from the University of Toledo and a PhD in public health from Rutgers University. In her spare time, Dr. Oyedele is a youth mentor and soon to be podcast host. That's amazing. Of the World Without People. I have quite a number of introductions to do today, but let me quickly bring up Olubukunola while she introduces herself before I introduce the other two speakers. Thank you for joining me, Dr. Oyedele. I'm flabbergasted. Okay, let's have a few words from you so I can bring up the other two speakers.
Thanks, Florence. I mean, I don't think there's anything else to add. I'm looking forward to having this conversation and just sharing a little bit of my experience, especially in public health like I said, that's actually my background, and it's an interesting topic because the stats show that there has not always been a lot of diversity, equity, and inclusion in the public health space, which is interesting given the fact that we are a very diverse nation here in the United States. So I'm looking forward to that conversation. And
Thank
thank you
you.
for having
Thank you very much. Yeah, that is not all. I still have two more speakers to introduce. Now I'm going to talk a little about Ngozi Cadmus. Ngozi Cadmus, like we can see on our screen, she's a CEO and a mental health and leadership expert. From a smile, trust me, there's a lot of story to say from that smile. Now I would show us just more information about Ngozi before I bring her on board. Okay, let's meet Ngozi. So Ingos is a British Nigerian psychotherapist, a social worker and business strategist. She overcame depression and suicidal oh geez, so that suicidality to become a leading mental health and leadership expert with over 15 years of experience in the mental health sector. She has sectioned hundreds of BAM individuals and thus is fully acquainted with the unique barriers that Black, Asian, and mixed heritage individuals face in mental health system. Ngozi is the CEO and founder of Frontline Therapists, an affordable and accessible, cultural sensitive online cons- and counseling service that target Black and Asian minority ethnic individuals, but isn't limited to all individuals from disadvantaged background nationwide. Additionally, Ngozi is the CEO and founder of Frontline Coaching, a data-driven equity, diversity, and inclusion and well-being consulting firm, a mental health therapy and leadership coaching to BAM professional talent. Her passion is such that she's currently undertaking a doctoral research project into the success determinant of Black women leadership across all sectors. By the way, Ngozi is in the UK. Now I'm going to bring up Ngozi just for a brief introduction so we can hear from her before we start the panel section. Welcome, Ngozi. Thank you for joining me today. I'm really excited. How are you? So let's just have a few words before we go to the last speaker.
Thank you. Well, thank you so much, Florence, to be on this wonderful panel amongst such excellent women, especially Black women across the pond. Yeah, I'm very passionate about this subject, especially in the area of mental health. I'm sure there are similarities that we both face here in the UK and in the States, but also some differences. So I'm looking forward to shedding some light to your diverse audience and some of the unique challenges we face in the UK.
Thank you very much. And now I will just take it down for a second and go to our last but not the least speaker. Last speaker for today, and that is Deborah Oluwashina. Like we can see, Deborah is the founder. She's also the founder of Women in Healthcare United States and also a public health advisor to the United States government of public health. I'll read more information about Deborah so that before bringing her on board to share more insight about herself. So let's meet Deborah. So Deborah is a public health advisor, a government project officer at the United States Department of Health and Human Services, Substance Abuse and Mental Health Service Administration. She is from Austin, so if you're in Texas, you want to scream out there. She's from Austin, Texas, and comes from a large Nigerian family. She's passionate about women's health and bridging the gap in inequalities seen across communities both nationally and globally. She obtained a bachelor's degree in public health with a concentration in community health from Texas Women University. She also obtained a master's of public health degree at Texas University, the School of Public Health, with a concentration in maternal and child health and global health. In the past, she worked with the state of Michigan as another epidemiologist, and helped implement the COVID-19 approaches and responses in communities across Michigan during the pandemic. She also worked as a program manager and grant specialist at a nonprofit organization called IGA Caring Arms, where she coordinated programs and services that served various communities in Austin, Texas. One of the highlights of our career is founding a nonprofit organization called Women in Healthcare with a vision to promote, inspire, and empower women to maximize their potential in every aspect of healthcare. She uses all of these experiences to be at the forefront of the nation's public health response and to the various crises of our nation faces. She works alongside leaders in the federal government to make an impact on the programs, policies, and laws that improve and promote public health. And on this note, I bring on board Deborah Oluwashina. Thank you for joining us, Deborah. Just one or two words to the audience in your own words. I know I've read a long biography, but just one or two in your own words so they can hear from you.
Hello, everyone. My name is Deborah Oluwashina. Florence did a great job of introducing all of us. So I don't really have much to build off of that, but I'm just excited to be here and to rub minds with other powerful women within the field and really just to learn from one another. So thank you for having me, and I'm honored to be here.
Thank you very much. And on this note, I bring every other speaker on board. Okay. Yes. We're about to start the session. I'll just come up here so we can start. So now we can see all our faces. I think we'll have more introductions. Thank you for joining us, Roy. Thank you for joining us. Someone from UK. There is no name there. Thank you for joining us, Tasha. Thank you for joining us, Tomiwa from Nigeria, Tasha from California. We have Peter from Lancaster, UK. We have Abiodun from Nigeria. We have Ndogesati from Nigeria. We can see some. We love Deborah. Okay, I'm gonna like that. We love Deborah. Thank you for joining us, Samuel. Thank you for joining us all. Thank you for joining us, Sam. Hi, Deborah. Deborah, it seems you're becoming very popular. We have a lot of people from UK. We have from
Aw.
UK, we have from Nigeria, we have from United States, we have from Kenya too. I want to say thank you all from joining us. We've had a very good introduction, and the topic we have today is what we all know. It's DEI in public health. We've done a lot of introductions, quite a number of introductions, and we can see that we have women's of excellence here, women of excellence. And your profiles, you all, I'm being flabbergasted, yeah, because you guys are making waves. You're making way wherever you are in the public health, in the mental health, and I would use the word envious, but in a good way. You get it. Like you guys are rocking it. Okay, thank you for joining us, audience. I'll be able to go back to see to read more from audience, but I want our audience to know that if you have questions at any time, please feel free to post it on the chat. I am following the chat up to make sure that all questions are answered. And on this first thing is we want to talk about DEI in the public health, and you all are in the public health space. So I want to know the first thing is what is your definition? What is your definition about DEI? And then we can go to your definition about DEI and the role it plays in the public health sector. So this is how we're going to do it because I want it to be an interactive section. And we have three, so it means that's going to take some time. So in one sentence, I'll start from my right, which I have my top right, which I have Ngozi. Is what is your definition in DEI about diversity, equity, and inclusion?
Okay, me, right? Brilliant. So the question is, what is my definition of diversity, inclusion, and equity? Right? Yeah.
Yes.
Okay. I always border, and I'm not politically correct, so apologies. But my definition of diversity, inclusion, and equity is it's a pompous word. I'm going to be very honest with you. I think the normal day-to-day individuals, those that work in the profession, we use these words, but most people, what the everyday person wants is they want opportunity and they want access, right? They want to know that they have the opportunity based on their skills, based on their talents. If it's, for example, for a job, if we're talking about health, they have equal access to health and care treatment. They just want to know that They are not judged because of the color of their skin. The treatment that's provided to them is not different because of their gender, because of the color of their skin, because of their accent, ethnicity, where they're from. They want to know that if when push comes to shove, if they need help, if they need a service, if they need to get a job, if they need to ascend up into the leadership ranks, they're not treated any different. The issue is that's not the case when we talk about it in the Western Hemisphere. The issue is that Black women like ourselves, we face barriers, both internally and externally, when it comes to mental health services, when it comes to leadership and ascension, when it comes to so many things that we do on a day basis. So that's what it means to me. I can give you a nice definition, but I'm sure one of my colleagues is going to give that to you. But I had to talk for the everyday person who doesn't know what diversity, equity, and inclusion is, but what they do know is that they want to live a good quality life. And they're not able to do that because of some of the difficulties that they face in the world.
Okay, Deborah, what's your opinion about that?
So I believe that diversity, equity, and inclusion comes into play when individuals feel like they have an even playing field, regardless of their background or experience. And I also believe that it creates a space for people to thrive and feel a sense of belonging, not feel judged by their limitations. And when people feel comfortable with their surroundings, they're able to interact well, and they can believe that even in their limitations, they can be limitless and successful. And unfortunately, minorities usually get the short end of the stick with this because obviously prejudices exist in our society, and um, we might not always be able to relate to people that we're surrounded by. And so I can actually attest to this. There's been many times where I'm the only minority Black person. Sometimes I'm the only woman, and this can actually be very intimidating. So I have had to like find ways to navigate through those situations. And one thing that I've found over the years is actually if I'm not given an opportunity to, be in an environment where I can relate to people around me, or see other people like me, or I can be around like-minded people, I actually create one for myself. And I create opportunities where I'm surrounded by people who I can rub minds with. I feel like I can grow. And I found this to be so liberating. And that's actually one of the reasons why I started Women in Healthcare a couple years back. I started at a time where I didn't really know what I wanted to do with my career. I didn't really know what I wanted to, proceed with, and I didn't really have anyone around me that I felt was in the same situation or having like similar challenges. And I had to create that so I can, find those type of people. And what it was honestly successful when it happened. And honestly, like, it's one of the greatest decisions that I've made because I've met so many women from different walks of life, and not even just women, men as well. And honestly, like, it's great to be able to relate to other people and see other people succeeding in the same areas that you're also trying to reach. And so yeah, diversity, equity, inclusion is very, very important in any environment that you find yourself in. And I think it should be something that is talked about more and prioritized in any workspace.
Thank you. So I'll go to Olubukunola now. So what is your opinion about DEI? Then now we'll have it an open floor to talk about DEI in public health from UK and from the United States. We have two ratio one. Okay, Olubukunola, take it.
Okay, well, I'll give you the official definition just because it's promoting fair treatment and full participation of all people. But like Ngozi said, I think when we just use the term diversity, equity, and inclusion, it can actually be, in my opinion, very limiting. We should just really just promote fair treatment. That's really the whole point of what it is that we're supposed to be doing without trying to give it a name. We don't need a name. We need action. And I think, like Deborah mentioned, what I find a lot in public health is I worked at a homeless housing organization, but there was nobody with past experience of homelessness that was in the board, who had worked there, and all of that, to kind of give them an understanding of what that was, right? And then that was something that I would explain a little bit to them, because I'm like, yeah, I mean, I may not have been homeless on the streets, but I've had those pockets of time when I didn't have a place to stay. I didn't know where I was going to stay. I had to stay with people at church or things like that. And, literally be able to say, hey, maybe we have this conversation this way. Maybe we have that conversation that way. Worked in the gambling organization, again, without people who've had that experience. They can't tell you how to better help give them services that they need. And that's a very important part of what we should be doing in our organizations, at church, right? Everywhere that we are. And I think that's what we miss sometimes in defining DEI in that way. It's not just having a term and saying everybody should just make sure you hire a Black person, make sure you hire a woman, make sure you this. That's the least of what it is. It's also, again, inclusion, right? It's having fair access. It's ensuring the voices that need to be heard in that space, right? Is heard, is available. There's room for that. There's opportunities for that, and things like that. So I think it's quite important that we're having this conversation. I suppose to your second question, I tried to look at the statistics. CDC, I don't believe, has had a woman or male Black leader. Yeah, I still have it on here. No, that was NIH. Sorry, NIH. No Black or male or female. They've had only 3 women. CDC has had 1 Black male, 5 women. Chief medical advisors have only been two white males. That's been a recent thing. But the Surgeon Generals, 4 Black females, 1 Puerto Rican female, 1 Puerto Rican male, 1 Indian male, 1 Japanese male, 3 Black males. And this is in a history of 500 years. I say all of that to say that we're at the highest positions of public health, we don't have people that represents the actual community, the nation here in the United States. And I'm sure, well, let me say I'm sure. I wonder if that's similar in the UK. And it really just then tells us that there's a lot of work to be done. In that, we're talking about color. We haven't even started to talk about people who maybe have experienced depression or mental health crisis. We've not talked about people who've experienced who are just disabled, right? Who can better talk about that kind of thing, and many other things that are included in this whole fairness conversation that we're having. So I think it's just something that we really need to look into as a sector.
Ngozi, I'll go to you. What is your stance of DEI in today's public health sector in the UK?
Before I answer, it's a twofold question, because you're talking about DEI at the level of within the public sector as an employer, or you're talking about DEI in how it installs its deliverables to the wider community?
I would want us to talk about both. Let's look at it in terms of statistics now of the number of Black women or minorities or BIPOC. I would like to know what the UK terminology is for the minorities. What is it in the public health sector? And of course, in terms of deliverables, in terms of programs, and what are they doing to achieve fairness? Bukola emphasized on fairness. What are they doing to achieve fairness coming from the public health sector?
Okay, so I would say first and foremost, unfortunately, there isn't a big difference in the UK versus the US in terms of the disproportionate amount of Black people or people of ethnic backgrounds, and then Black women in senior leadership positions within public health, which we would put that in the UK as the public sector. So we've got something called the National Health Service, which is essentially a free national health service at the point of delivery from our taxes. And then we obviously got private health, etc., etc. Then we've got the third sector, which will include not-for-profit and the voluntary sector, and then we have the private sector. So across the board, Black people, people of ethnic minorities are underrepresented. And when it comes to the deliverables, so delivering support towards the community, there's inequalities. So the Public Health England would say that they are trying their best as possible to try and, I guess, tackle the inequalities and health disparities that occur. So the same way in America, Black women are more likely to die at childbirth. In the UK, we're 5 times more likely than our white counterparts to die at childbirth. Black women and Black people in general are 4 times more likely to be, you guys call it committed, we call it detained in the mental health system. So in a psychiatric ward, where somebody is deprived of their liberty, they're 4 times more likely to be detained, and they're more likely to report poorer outcomes when they are engaging within the health sector. They are more likely not to be referred to psychological services within the UK. So there are inequalities that Black people and ethnic minorities face. The terminology that we use is BAME. Sometimes we use BAME, Black and Asian ethnic minority groups, Black and minority ethnic groups. There's a new term, which I don't think is any better, but a new term is the global majority. So you might hear people from the UK talk about the global majority, because that's a global majority. Africans, Caribbeans, and Asians are actually the majority in the world. So you might
Mhm.
hear people from the UK. I don't think it does anything better, because at the end of the day, it's still a term that puts us all together and doesn't differentiate the differences between the different groups within that terminology. But essentially, within public health, so let me take away from public health, the NHS, the biggest employer in the whole United Kingdom, there is about eight Black and Asian individuals,
Oh, really?
CEO at the head of the local NHS. So NHS is the wider thing, the wider umbrella, and then every local area has a trust, has an institution under the wider umbrella, and there's only eight Black and Asian individuals that are at the top of that, right? And the NHS hires the most ethnic people in the whole UK. They're the biggest employers, and the majority of the of Black and Asian and ethnic individuals are in, and there's only eight of us right at the very top. So you can already see the disparities in terms of our voice and our presence and our influence and our input being considered and being at the leadership level, let alone what that means then for the dissemination of interventions on the community. If you haven't got people that look like us able to understand the impact on the culture, the impact in the communities, the impact on inaccessible populations, hard to reach population, these are all the terminologies that they use, then yeah, you're going to have an issue on the ground, and which there is an issue on the ground, which is what I've stated already.
Wow, thank you very much. I like the fact that you're able to describe what BAM means, because I was going to ask you about that. That what does BAM means, but now I know it's Black, Asian, and the minority group put together. I before I go to Deborah, you said that you only have hits. That's interesting. I know in the United States it could be a little bit bad, but I didn't know it's going to get that bad. Okay. I'd let Deborah say share our own opinion about what is your own stance? What do you think? What do you think we have when we're talking about DE and high diversity, equity, and inclusion in today's public health sector in in the United States?
Yeah, so I would actually like to look at the statistics. A lot of the programs and services that governments put out and programs put out are for marginalized populations, populations where they're disadvantaged, and people are on welfare and they have to depend on a lot of government resources. And so um, I think it's funny how like a lot of the programs that we are putting out are targeted for those type of people, but there's no one in leadership, there's no one within those programs coordinating things to actually like benefit the people within those populations. Yes, of course, like it looks good to be able to say that, okay, yes, we're trying to find solutions to these problems that these people are facing within this population, but there is no cultural competency within that. You have to you have to be educated. You have to have people on the team who have come from similar backgrounds, who have experienced those things, to be able to really say that, okay, yes, these are beneficial solutions that we can use to provide these people so that they can actually come out of these issues and not return. That's another issue that we see. When we put out these programs, it's kind of like a band-aid over a lot of the issues that are seen in these populations. And then we've actually found that these individuals, they become incarcerated, or they really never come out of the same cycle that, we're trying to put programs out for. So I think it's so important to include people who are actually from these populations, who can relate, to train your team on cultural competency, and just really to understand how different individuals function from different walks of life. And I think I would also like to break it down by I think there's different levels to this. So in leadership, a lot of times we see that it's mainly men. We hardly see women, and even if we see women, a lot of times it's probably a white woman. We don't really see minorities in leadership, and I think this has to do with intersectionality. As a Black woman, you're already at a disadvantage because you are Black, and on top of that, you are a woman as well, which I don't even need to elaborate on that. Women go through different, inequalities on a day-to-day basis, regardless of whatever race you come from. And so I think that there's so many levels to it, and those things need to be addressed in order for us to see a change in these programs and policies and the laws that we're putting out to benefit the people that we actually are saying that we want to help. Because at the end of the day, I feel that, without diversity, equity, and inclusion, there is no real way to find out, what these people need, and to really like create a long-term solution to these issues that we see in these communities.
Thank you very much. I know the topic we have today is still the mental health, because we really want to look into the mental health. But I just was curious to know more about what we have, where we are at, in public health sector. And it's interesting to say that there is not so much change. So I'm saying this out to leaders out there, that there is a lot of work to do when we talk about the disparity, unfairness, and injustice that is done to minorities out there. So now our focus for today is looking into the mental health sector or aspect of public health, which relates to a lot of people in and out of the public sector, because everyone, we all have a mental health, and this has been recognized as a organization benefit. I want to believe so. When we see organization talking about mental health as a benefit, which actually annoys me anyways, but I would try to take away my own judgment. And let's hear from the expert, because you all here are mental health expert. Deborah is a public health advisor, so, and you talk about mental health because I can see that you created women in healthcare, just to make sure that you talk about those inequalities, and Ngozi does the same. Olubukunola does the same. You all talk about mental health, and that is why I have this session consecrated on mental health. And we want to talk about how we can strategize towards a balanced both LT mental health. So our focus is on mental. So what role now do you think, before, because it's DEI, before we go into mental health as a benefit, what role do you think you hold? What role do you think, or what role do you think DE and I plays on the employee mental health? Bukola, I will say you go first.
I think it's very important actually, because I think Deborah was the one who had mentioned it about when you go into a room and you're the only one who's Black, you're the only female. For the longest time, I used to feel like I was the youngest person in the industry, because I didn't understand why I would go into a room and 90% of everybody there was in their 50s and up. And I'm like, I'm not understanding. It's public health. Like, why are we not teaching people about this? And, it's funny because I think that it's still a very cultural thing. People still don't understand what public health is. I think, or they don't think it brings value or money. So everybody goes into careers that are more financially, they'll bring more finances and stuff. So you continue to even see that even till today. So it's one of the reasons why I like this, because we need to promote the fact that public health is important. But mental health, especially, I think when I go into a room and I'm not like wary because I have to then put in my full armor,
Mm-hmm.
deal with all the microaggressions, all the conversations, everything that happens in a room where I'm the only female or where I'm the only Black person. I have to go into many rooms where I'm the one advocating for someone's mental health or, like I said, homeless situation. I think an interesting example that I saw on social media was when a woman was patting her hair, like the typical, you've done braids and you're patting
Yeah.
your hair
The
because
black women will do that a lot of time.
yeah, because like it's itching, right? And one of the doctors had wanted to commit her because they didn't understand what was going on. And if it was another Black woman that had come into the room to be like, oh no, like her, she's just itching, right? And that's just a very small example of the fact that if we don't have people who look like us, people who understand, I can imagine if you have some kind of skin condition and you're itching and someone else can say, hey, I understand what you're doing, and nobody else kind of feels some kind of way, whatever it is. Someone is autistic, and they're behaving in a way that nobody else in the room can understand. But if we've not learned it, we've not educated ourselves, we don't have people in the room to talk about those kind of things. Whatever it is, how people have talked about food smelling, because you cook different food from other people, those kind of things. So imagine going into your work lunch place, and you really want to eat your eba or whatever it is, and you are conscious about not being able to do that because how's somebody going to look like you? Those things affect our mental health. And I'm making it very simple. I'm not even talking about things where we have to deal with like depression, anxiety, all those kind of stuff, because we have to understand that, like you said, having a balance, it starts from just your everyday things that you have to deal with, much less now someone who already has anxiety or tendency to suicidal ideations, and you walk into a room and somebody just says something recklessly because they have no understanding, they have no basics. So I think that for me, it is a conversation that needs to continue to happen. Like I said, I'm not really sure I like the DI name, but really just again speaking up about fairness, equity, inclusion, diversity, differences, understanding that cultural competency, like Deborah said, educating ourselves, especially before we speak. So yeah.
Yeah. I'd like to know from the UK aspect, Ngozi, what is your take on the role that DEI play on employees' mental health?
Thank you. Just to say before I answer, Derek Rubai, yes, the term global majority is a new fancy word that some people in the UK are using to denote people of color. I don't like it. I just think you should just call me Black or African, call them Asians. It just to me makes it easier. But the UK has been using terms to approximate people of color together for a very long time. So the link between diversity, equity, and inclusion and mental health is interesting because essentially what we're talking about is psychological safety, right? Mental health is all about how you feel about yourself, how you feel others see you, and how you feel about yourself in the world, and that all mental ill health comprises of those three elements, because it's really about yourself in relation to those that are around you, right? Anxiety, depression, from schizophrenia to bipolar to all the different types of personality disorders. So as my Olubukunola said, that people are already coming with things, right? People are already coming with maybe anxiety, people are already coming with depression, people are coming with many different things, but some people are coming and they are mentally well. And then when you go into an environment that is hostile, right? There's some environments that are hostile, not just because of racial issues, they're just poor, toxic working environments, let alone if there are underlying prejudices, discriminatory practices, etc., etc. So I think the key issue that I will emphasize is psychologically safe. How safe do you feel you are when you're in the workplace? So for those that are listening, how safe do you feel that you are, that you can be your authentic self? I don't mean you bring your all of yourself, because I don't think you need to bring all part of yourself to any situation. But the self that you do bring, how authentic is that? In bringing that part of yourself, are you free from criticism unnecessarily? Because we're all going to get constructive feedback, but is the feedback you're receiving more on the side of tearing you down as a person, right? I don't need to give examples that Olubukunola has given already, but statistics say that Black women, especially in the UK, believe that they are more likely to be overlooked for promotions despite having equal competence as their white counterparts, right? We are more likely to experience both being invisible and hypervisible. It's a weird dichotomy. You're invisible because your talents and your skills are not being recognized, but you're hypervisible because if any mistake has occurred, there's probably a bit more
Yeah,
scrutiny
thank you.
faced than your white counterparts, right? Your the nuances and the intersectionality about being a Black and being a woman, and if you've got any other thing, maybe religion, if you are from a particular part of Africa or the Caribbean, if you've got an accent, if you're born in the UK, born outside the UK, all of those things intermix, because when you're in a situation where you are spoken to in a certain way, you're addressed in a certain way, or you're not given an opportunity, or you're not given a job and you're told you do not fit, right? The word, you do not fit, you're not what we're quite looking for. What does that mean, right? For some people, right, they are wondering, what's going on? Is it because I'm a woman? Is it because I'm Black? Is it because I'm both? So the thing that we face in the UK, and I think in a lot of European countries as well, is that racism is no longer overt. It's very implicit. It's a form of gaslighting, I would say, because it confuses you. And when you're in an environment where you're just trying to do your job, right, you got to think about an everyday Black woman, an everyday Black man, an everyday woman of color is trying to live their life, pay their bills, have a good quality of life. But when they go into work, as you already said, you have to have an armor. You have to put on armor, right? That is very stressful. That is already intense, right? The level of resilience that you have to build up. We already know that very few racial discriminatory cases go to tribunal and win. So you're already aware that if something did occur, how likely is this battle that I'm going to fight? Am I going to win at the end of it, right? So, and you got the saying, pick your battles wisely. We get told that from a young age, pick your battles wisely. We also get told that we have to work twice as hard just to be determined as good enough as everybody else. So I'm saying all of these things to say that imagine just wanting to work. Life is hard. We've got a energy crisis. We've got a war in in Europe. You know, and we've also got what do you call it? Inflation on the rise. But we were in a crisis already post the pandemic, right? Everybody's struggling, and then you want to add that when I go into work, I have to face microaggressions. I have to face the potential that I might not get this job just because I'm a woman and I'm also Black.
Okay.
Yeah, I think that's going to impact the mental health of a lot of individuals from minority population. So I think it's all about how psychologically safe do you feel you are at work, and if you're not, then you have to begin to ask the question: is that the right environment for yourself?
Yeah. Before I go for to let Deborah give her own opinion, Deborah, you working with the United States government actually would make me talk more about policies here. And I know that the policies that we have in the United States may be a little bit different from those that will be set in the UK. But I will just highlight this. I was supposed to go into mental health as a benefit, but from what Ngozi has said, wants to bring me up to this question. Let's talk about policies and regulations. And Deborah, you take a lead in this. What policies, what regulations, what procedures, what law, what governance should we put in place that will relate to mental health that we need to consider, not even just the HR or business leaders, but as an individual, as an employer herself? What policies do we need to put in place to protect our mental health?
Honestly, I think that it's important to hold employers accountable. I feel like when a lot of issues rise is where these employers, they have no accountability. They can pretty much say anything they want, do anything they want, and they get away with it because, as Ngozi was saying, um, it's something that it's not, you can't really spell it out all the time. Microaggressions are very hard to explain to other people, especially if they don't come from the same background as you, or especially if they're not the ones experiencing it. And so I think that it's so important to hold employers accountable and put policies in place to ensure that people feel safe, and they feel that, you know, they're heard if something is happening, if there's a crisis, and that they're not going to be judged, they're not going to be gaslighted. And um, honestly, I don't like working for the government. Honestly, I don't really feel that they're doing such a great job about that, because um, it's hard to hold these employers accountable, especially if people are not speaking up. People are afraid to speak up because they're afraid they're going to lose their jobs. They're afraid that people are going to look at them in a different light, and so many things like that. And I can actually speak from personal experience, where I was working at a place where, like, pretty much every day, like, my boss was saying racist things to me, and I couldn't really explain it to anyone around me because no one else looked like me. I didn't really have anyone that I could relate to, so I had to deal with it pretty much every day. And I think I was a bit younger at the time, so I didn't really know how to deal with these things. I didn't know like how to escalate situations like this, and so it was very hard for me. And you know, I would always go home, and sometimes I would be really sad and depressed about the things that, you know, was being said to me, because this is somebody that I work with every single day. So I think it's just so important to one, hold employers accountable, but also create resources for people to, you know, have an outlet and actually speak and feel like they're going to be heard. And I think that's where HR managers come in into play as well. They can be a listening ear for these people that, you know, feel that they're not being heard, or that feel that, you know, there needs to be a change. And ultimately, like, if you're somebody that is going through a hard time at work because, you know, your manager is being racist, or, you know, somebody sexually harassing you, that's another topic that we're not even speaking about right now. But there's so many different things that you can go through in a workplace that it can be hard to vocalize. And I think creating a platform for people to speak about those things in a place where they don't feel that they're going to be judged, in a place where they feel like they're actually going to be heard and something is going to be done about it. I think that that's so important. And I would say it's easier said for sure, because like, how do you actually hold these people accountable? So there's so many levels to it. And I think that inviting employees into the conversation is also important. So as a manager, you should actually be asking your employees this question, like, okay, how can we make this a safe environment for you? And they'll be able to, you know, give you the solutions to that, because I don't think it's a one size fits all situation. Every workplace has a different culture and they function differently. Some workplaces are virtual, some places are in person. So there's so many different cultures of work. And so I think it's very important just to, as a manager, as a leader, as an employer, to invite your employees into the conversation and ask them what things that they need to put in place in order to make them feel safe and heard, and in order for them to really just function well in that space.
Thank you very much. To Abayo Militias that asks the question, how can public health organizations ensure that the programs and policies are culturally responsive and address health disparities? I want to believe that Deborah has been able to answer that question from the United States point of view. I would let Ngozi also tell us from the UK before I go to Olubukunola.
Okay, so how can public health organizations ensure that their programs and policies are culturally responsive and address health disparities? So, um, look, I'm just very real. The research has said, yeah, I don't know about America, but I think it's very similar. The issues that we're facing in 2023 are the issues that we faced in the 90s. That's nearly 30 years. I was born in the 90s. That's nearly 30 years. So personally speaking, organizations have a different level of change process. The level of the transformational change that we want to see, I think takes much longer than what happens in a community level. It's much more quicker. So personally thinking, accountability has been suggested since the 1990s. It isn't happening. So I personally think we need a new strategy, and I think there's power in numbers. So I think that, you know, if as Shirley Chisholm says it, if they don't give you a seat at the table, you bring the damn table. You are the damn table, right? It's understanding your power, it's understanding your potency. So the way I believe that policies and programs should happen isn't waiting on them to do it. Isn't waiting on them to do it. Is banging on their door. Is putting ourselves in position. Is awakening ourselves and entering into senior leadership positions. In America, you call it board advisors. In the UK, we call it non-executive directors, which are basically not executives that are operational, but they are directors that affect change in the company. They just don't work in the company itself, right? Those are opportunities. So you could be doing your full-time job and do a little part-time gig in a company there and affect change in the company. That is how I think we can be affecting change. We need to get into leadership. So I take a lot of responsibility on ourselves, not because I place the blame on us, but it's because I don't know what more we can continue to say that we haven't been saying for the last 30 years, and change is very slow or has really stalled. And they're doing a lot of rhetoric to make us and pacify us, to make us feel that change is occurring. It isn't occurring. Research has made it very clear the issues that we are facing right now, the same issues we faced in 30 years. So to me, it means what we are telling them to do, they're not listening. So I don't think we should repeat the same thing. So my personal and professional advice in terms of how we can change is we need to get ourselves in leadership positions. And I do understand they still have to let us in, but the more people that apply, the more force that is put on a door is eventually going to break. The issue is we're doing this and saying, you've got to change, door, you've got to change, rather than saying, we're forcing you to change. So we need
Yeah.
more force and we need more numbers. And then we make change. So all of this accountability in organizations, look, money is the bottom line. They follow the money. So we have to get ourselves economically powerful so we can affect change.
Thank you very much. I would also give the mic to Olubukunola Oyedele. Dr. Oyedele, tell us what you think about the question that has been asked and ways that we can provide solution. I like what Ngozi said, we're bringing everything together. Yeah, we need to impact it. We need to make that change because sometimes if we keep saying the same thing over and over and over again and there is no response, there is no one listening, you probably will get tired or it's two ways. You either get tired and not talk or you get more active and you go in together in numbers and you riot, you fight against what you want. So now is the time for us to speak forward. But before I go into my own opinions, I'll let Dr. Oyedele have the floor.
Thank you. I mean, I think Ngozi has said it all, but I will add something to first the earlier question about kind of like HR, business leaders, and things like that. I think we definitely, which is something Deborah has encouraged me to do as well with her business, with the women in healthcare. That's really what it is, right? We as women, black, whatever color, whatever your own place for inclusion is, we need to create those organizations. But what I'm finding is that there are a lot of people who are starting startups day in, day out and having um, the same old culture, right? So they're not even putting in you went and you had all these fights with all these other people and you're like, oh, I'm going to start my own business, I'm going to do something different. And then you end up doing the exact same thing. Somehow, 2-3 years down the line, your company has the same culture like every other company in the past. We need to do more. We need to do better, right? We need to ensure that if we're creating something, we're actually creating something for change, right? And it means that we're hiring the right people, right? We're hiring people who have that same culture. If they don't have it, we're going to teach them, and we're going to be very, very intentional about teaching them because we're going to stand out, right? We're going to be different. We have to, from the beginning, also have a place that is diverse, right? That is inclusive, and it's little things, sometimes people would start with people that are maybe their mates or their friends and things like that, and they're like, oh, we need to build, and so I'm going to go get somebody who's from somewhere else who, because maybe he's that color, or he's male, or because it's male, then he's gonna, be able to push us forward, because, how are we gonna get into the room? Well, you get into the room by doing the right thing. You get into the room by drawing well, by being efficient, by doing, by putting in the work. You don't go bring somebody else to say, oh, let's have a face, right? So that we can better enter the room. So we need to change our mindset about some of these things. We actually really need to we really need to do what's this, what we're about. We need to not just talk. We need to be active. As far as organizations ensuring that programs and policies are culturally responsive and address health disparities, I think both what Ngozi said and what Deborah said is very, very key, right? We need to act. We need to call out for more inclusion. We need to call out for more accountability. But I think one way that we can that we've not talked a lot about is maybe just changing mindsets. And I know that seems like very it seems like, oh, we've always been talking about that. Why aren't they listening? But we have to give them the story that they will hear. I think sometimes we are so caught up on fighting for ourselves that we're not understanding that there are other people who are going to come in later on. Whereas I don't have to be the one to win, right? I may not win that conversation then, but if I ensure that whoever comes in next, right, is going to have a different environment, that sometimes is enough. And so it's speaking up over and over again, sharing the mindset, asking for change. Like Deborah said, we really do have to ask for that change. They're not just going to give it to us. So you have to go there and ask for it. You also making, like I said, you standing out even is enough for someone else to make what's it called, make a change, right? It's being that person where they're like, oh my gosh, you're the first Nigerian I met who blah blah blah, and I love all Nigeria, right? And changing that story for them, because what happens is people have a story in their mind. They have a story in their, and it doesn't change until they're met with that force, kind of like she said. And that force is you, and that force is your representation. That force is you speaking up. That force is you asking the right questions, showing your talent in a very awesome way, and changing that mindset. So I think that's just what we can do. And lastly, I will say maybe also not accepting things. So a community, an organization is going to come into your community and be like, this is what they're going to do for you, without having spoken to the leaders in the community. I think people should stand up and say, no, we don't want this, or just actively don't use the service. So they understand that you can't come into my community or come into whatever and make changes or say that you want to help us without including us. I don't know if that makes sense, right? Because without my input into a service that you're saying is for me, then you're clearly, again, partly what I was saying about stories. You already have a story of what you think is best for me. And that is unacceptable. And I think sometimes we need to let them know it's unacceptable. We're not using that service. We're not going to come into whatever thing that you're trying to do. We have to make sure that we let them know, like, hey, if you're going to provide a service for my community needs to be included. There needs to be representation from stakeholders from my community that are telling us this is the way we should go. And I think that's something we really need to do. We need to just sometimes not accept everything that is being offered to us.
Thank you. Thank you very much. Thank you for that, the breakdown. I really appreciate it. As someone said this, which I want to highlight, is inclusion is indeed very important. Talking about mental health, we cannot relate the importance of inclusion. That is why we talk about DEI, B for the belongingness. Because if you don't belong in a place, if you don't feel belong, like you don't feel that belongingness, being in a place, you definitely cannot feel included. You cannot feel like, you only feel like you're just a number. And that is exactly one of the things that organizations are beginning to do, is just about marking the numbers. How many, what's the demographic? Okay, we have 5 Black, We are out of the 5 black, we have 3 black women, we have 2 black males, we have 3 Asian, we have 6 Hispanic. And DE high, DE and high, or DIB is more than that. Is more than I really like the fact that we're having this conversation in this month, because this is the Black History Month. This is the month where we celebrate the Black history, and we cannot celebrate the Black history if we our own history if we're not talking about things that really matter, things that really should be talked about, things that really brings us together, not just things that put us apart. And there's one word I use because I have a newsletter that would talk about the human in the humanity. We are first of all human. Doesn't matter your race. It doesn't matter if you're black, white. I'm gonna just share this. I was listening to a short video that was talking about the way he described DEI. It described diversity. He said if we're gonna put a pot like in Africa we call it ikokodudu in Nigeria. If we put a pot like ikoko, we put a pot, a calabash, whatever your description is, you put the water into it, then you take another calabash, you put the water and some coloring into it, then you take another calabash. Let's assume the first one you put the first one is a plain water, a clean water, the second one is like an orange water or white water, the third one is let's say black water. Please, can you tell the difference just looking at the pot? You cannot. The content is different, yes, but the truth is what it's still water. It doesn't matter what color you put in or what color the calabash is, it's still water. The same thing goes in if you put different colors of calabash or different colors of plastic. It's still water. I have water here. If I put my water in let's say this is a pink bottle, it's still water. So why are we describing being black, being white, being yellow, being brown? We are still human, which is why I have that the newsletter called Humanity in Humanity. Before we go into the last aspect is the last aspect for today's show, which is the organization culture, looking at mental health as a benefit. I want to just tell our listeners once again, thank you for joining. If you're just joining, this is a DIB small talk, and we talk about all things DEI. That talk about DEI, diversity, equity, inclusion, and belongingness. If you're just joining us, you can introduce yourself. If you have a question, please feel free to post your question. Our guests would definitely treat them as they come. So now I'm going to go into mental health as a benefit. And this is because organizations, HR, I mean the HR department, I know we're guilty of this. We're beginning to describe, you see people talk about work life balance, you see people talk about of course some organizations even give you the benefit or allowances for you to see your counselors, to see therapists if you need if there is a need. But to me now, half the question is, should we be regarding mental health as part of organization benefit? Is this right or not? I'll go to Deborah.
Yes, I do think that mental health services are very essential in any workplace environment that you find yourself. People are going through real life situations outside of work. So you might have a loved one that might have passed away, or you're grieving someone that you're no longer friends with, or you might be dealing with a lot of financial issues. I think it's important to have services and have outlets for people to speak about these things and feel that they can be helped and resources can be put together to help these people. And also paid time off, taking breaks from work as well is also very essential to help people internalize the different things that they're feeling and to really just help them navigate through those things. I really do feel that mental health is really just how you function emotionally, psychologically, and socially, really, with people around you. And I think it's so important to incorporate into work because obviously a lot of us are working to to have money to pay our bills and things like that. So it's not like majority of us can live without a job. And so if this is something that we're depending on so much, it should be something that's also benefiting us in our crisis. Like, we're not always going to be at our best, but what resources are put in place for me to come out of those crisis or the challenges that I might be facing. And that's why I love the fact that we're talking about diversity and inclusion, because that I think that also goes a long way in creating very positive work cultures as well. I saw a post today that said having a greater salary, having a higher salary and a good I'm sorry, I'm mixing it up. Having a lower salary and a toxic, oh my gosh, I'm mixing up this entire
I want to
thing.
believe it's going to be having a higher salary and a toxic work environment, and having a lower salary and
Yes.
a good
Yes.
environment. Trust me, people rather go for the
Exactly. So
come up with
you
one
rather
point.
have a lower salary and a positive work environment as opposed to having a higher salary and a poor work environment. And it really does go a long way to have a positive work environment, because if you don't, you start creating unhealthy habits, you start falling into depression and so many other things. And so I think it's just so important for us to incorporate diversity and inclusion into mental health practices that we see at work. And also for those of us who are in these positions, that we can create opportunities for other people. I think it's so important. So like right now, like at my workplace, I'm probably one of the youngest people, and I don't really see, there's not so many women, and there's not also so many minority women as well. And I think that me being there, me having a seat at the table is important for me to advocate for other people that look like me, to put pressure on the leadership to say that, hey, yes, you have, very, I'm sure everyone that works here is very, they have a lot of skills, they're very talented, but we do need to ensure that we're not being biased, we're not allowing those prejudices and unconscious bias to limit other people from these same opportunities, and really just advocating for people who don't have that opportunity, because I think it'll then become a domino effect. You bring somebody on, they bring another person on, and so on and so forth, until it grows to where we actually have a voice and we're seen, and the entire environment it is mixed, as you said. With the contents within the in the same pot, it you can't really tell on the outside, but and I think that's how it's supposed to look. You're not supposed to be able to spot the differences. You're supposed to just be able to have everyone be able to integrate and really relate to each other, and just benefit from being with one another. So I think it's just so important to incorporate mental health into workplaces, and also diversity and inclusion as well.
Okay, just for us to make sure that we are going to take questions as they come. I see some questions already coming in. I would just skip some few questions to organizations, the list and listening organization leaders that are listening. We've heard what Olubukunola and Deborah said. Ngozi is currently taking some calls, so which is why she's not talking about it from the UK perspective. But when she's back, she'll be able to give one or two input. So just to say for organization coaches and to line managers out there is, we've talked about how mental health can be benefit, but no matter how much you want to make sure that this is a benefit, you have to make sure that it's fair, it's just, and put the employee's heart in place, because people come first. It doesn't matter what organization it is, it doesn't matter what sorry, pay or other benefit you think you want to offer. Mental health is very important, and having that positive mental health, because there is negative and there is positive. Having the positive and the balanced one to the heart of organization is very. So I'll go to the last one, the last session. Now we do have a special request, which I would direct the questions to you two, Deborah and Olubukola. But before we go, let's talk about strategies that we can give to employees to utilize and achieve a balanced but healthy mental health in today's workplace. Okay, Ngozi is here, so let's Ngozi go first.
So can you ask that question again?
Yeah, let's talk about though we're talking about mental health as benefit. So you can say one or two words about what you think about mental health has been a benefit in organization, workplace, in organizations, and while building organization culture. But the question we have now is, what strategies can employees utilize to achieve a balanced but healthy mental health in today's workplace?
Okay, good question. Okay, so essentially you're asking how can employees have maintain good mental wellness, yeah?
Yes, that's correct.
Um, of course, I'm going to always say, as a therapist, probably seek therapy. That would be the first instance. I think having therapy enables you to have a good mental health all around. I think employment is a big part of our lives, but it is one aspect of our lives. And if we are struggling in our workplace, we are likely to struggle in other areas of our lives as well. So I think therapy is important, not just for employment, but for your life. And of course, hopefully your workplace has an employment assistance program, so they provide therapy as a benefit um, in as part of your um, wellness package. A second thing would be having a space where you can speak to people and be honest with people, whether it's in work, you might have a few work colleagues, or with family and friends. I think it's really important to have an anchor and to be supported, because that's going to enable you to thrive in all of your environments. That's what I would basically advise, as just because I was out of the conversations prior to this. But yeah, that's what I'd advise. I would say therapy in the first instance, and I will say having supportive family and friends are two things that can help you have good mental well-being.
Thank you very much. Okay, I'll go to Dr. Oyedele. So, how can we achieve a balance but positive mental health? What strategies would you give, or advice would you give to today's employees?
Um, that's a good question. I've been thinking about that, but let me actually go back to what the conversation around the higher money versus lower salary
Oh,
kind
yeah,
of.
I can see some controversies going on in the
Yeah.
chat about that. Some people say, I would go for bigger salaries and toxic environment.
Yeah, and I
Some
want to talk about that because that's actually not an unfair thing for someone to say. Really and truly. There have been times in my life I would go for the higher salary. Like somebody said, you sound like a millennial, and it is possible. Maybe if you're a little, if you're a little hungry for trying to get somewhere, right? Like you're like, I'll just take the money, let's run. But taking the money in an organization where they don't give you mental health benefits as part of your organizational benefits, then that's problematic, right? Because you are going to burst somewhere, right? You may be achieving everything at work, but your family is suffering, right? Your relationships are suffering. Your relationship with God is suffering. Those kind of things. So I think when we talk about mental health, kind of like Ngozi said, it's a balance. It's a balance not just in one area of your life. So I want to, because the truth of the matter is 60%, we spend maybe 60, maybe even more percent of our lives kind of like around our career, business. If you're a business owner as well as someone who's working in 9 to 5, it might be up to 80, 90%, right, of your life centered around work. But the truth of the matter is, think about someone who is sick, like I have to go, I have to go get a surgery or something like that. You would give me all this benefits, right? You would help me in every way to kind of get back on my feet or whatever. A lot of people don't even know what all the best resources are to help you if this was a mental health crisis. And the point is, you want to kind of already fortify yourself before you get to that kind of place, before you get to somewhere dangerous, because like we've kind of explained, right now, mental health services are not, they've not put you into consideration. They've not put your uniqueness. They've not put, for example, one of the things I struggle with is in trying to look for a therapist is, I'm Nigerian, I'm a first child, and I'm Christian.
Mhm.
All of those things already give me a certain level of resiliency that I have to deal with, but also a certain level of, I can't do this. Like, you can't tell me to just ignore everybody and just focus on myself. I'm a first child. I am going to, I have to think about other people, right? I'm a first girl child. I have to do this. I have to do that. Nobody's going to tell me my self care is 100% my self care. I don't care what you're saying as a therapist. That's not going to work for me. So how do you meet me where I need to be met? And I think so. Then it goes back to the second question of workplace, organizational culture is really investing. Leaders really, really need to invest in their people. And what that means is knowing that person uniquely. I don't think we spend a lot of time, and I'll be honest, that's one thing I try and do the most in anything that I'm doing with younger people is I really want to know you. Are you the first child? Are you female? Have you had some, really what's the word I will use? Some things that have threatened your life. So maybe you were abused domestically, or you're a child survivor of that, or you were abused sexually, or stuff like that. Knowing that person, and that's really, I don't think we talked a lot about the equity in all of this, right? The equity in all of that is
Okay, I'm gonna put you. I'm gonna pause you there. I think we're gonna have another series
all
because
right, good.
there is a lot to talk about. I want to believe we're going to have another series. I'm going to work with you guys because there's a lot of questions coming in right now, like a lot of questions, and people are still typing. So maybe we're going to have another series. I know we're over time, but there is a lot to talk about when we're talking about mental health. Sorry to cut you short
No,
there.
no worries.
I want to quickly hear what Deborah has to say so that we can take in questions before we go into the spirit of DEI equity. Let's not go there today. Oh no, we won't live here if we go into equity. Okay, Deborah, let's hear what you have to say.
Honestly, I think the first thing I would like to say is that your job is not your identity. I feel that a lot of times people identify themselves, their personality, they surround their character and everything around their job. Oh, I'm a doctor or I'm a lawyer. What if you lose your job tomorrow? Then what are you? I think it's important to have an identity outside of your work so that when you are not working, you're able to, put your mind on other things. A lot of times, even when on our off days, we're still thinking about work. We don't take breaks. A lot of times we might be so zoned in on our jobs that we don't eat all day. We find out that, it's late at night and we haven't taken a break all day. And I think it's just so important to just be intentional with self-care and protecting your mental health. And if your job is being overbearing, if your boss is overworking you, vocalizing those things. Most times all of us should have a time where we cut off our work. So the regular schedule for most people is 9 to 5. After 5, you should have some way to unwind and just get your mind off of things that you're doing at work, because sometimes work can get very stressful. It can be overwhelming. A lot of the things that we're doing it's we're dealing with other people. We're dealing with other people's personalities, and there's also so many challenges that come with that. And so I think it's just so important to just have some type of outlet outside of work, whether that's hanging out with your friends or having a hobby, or, just watching TV, watching Netflix, just having some type of outlet outside of work to ensure that you yourself are keeping yourself accountable and you are practicing healthy mental health outside of work. And I guess in work, as Ngozi said, having mental health therapists, having a platform where people can speak about different things that they may be going through, or even just being able to relate to your colleagues. You might not always have to go through all those levels before you could find a solution to something you're going through. You might be able to relate to one of your colleagues and they can give you a solution or really just help you through whatever it is that you're going through. They might be able to take on some of the tasks that you're taking so that you're not as overwhelmed. And so I think it's just important to actually hold yourself accountable and make sure that you are not overworking yourself. You're not burning out. You're not waiting till it gets so severe for you to then find help. I think a lot of these things are preventable. A lot of these mental health issues that people have, anxiety and things like that, it starts from somewhere. It started from somewhere. It started from them, being overwhelmed in a situation. They begin to overthink, and they're hard on themselves. That there's so many things that come into play when it comes to mental health. And I feel that before you get to those severe levels of poor mental health, there's so many things you can do to help yourself and really just hold yourself. But honestly, out of everything, I would say it's just important to hold yourself accountable and to
So,
also give boundaries to people around you as well. Sometimes our colleagues or our bosses may overstep those boundaries, and also holding them accountable and making sure that you're not just allowing them to walk over you and really just push you around. So I think really ultimately holding yourself accountable to practicing healthy mental health practices is the most important thing.
thank you very much. Thank you. And now we're going to go into. Yeah, thank you very much. And now we're going to go into the question sessions. We have some questions that are coming in, and some people are still sending in their questions. So we would want to take a few questions that we can take and make sure that we answer as soon as we can. And the first question we have is: with our experience, do we believe that DEIB is often used as buzzword? Or is it that of the HIB initiative impactful? Are they impactful, especially on employees' well-being and mental health? Just because of our time, we won't be able to go around the questions, so I will just use my discretion to point out to who I think will best answer the question. I'll go to Olubukunola to answer this question.
They're effective. They're as effective as they are inclusive of the people that you're creating the initiatives for, right? Again, if you're just carrying it as a buzzword, I remember when all of this was happening during the shooting of I'm forgetting his name right now, especially here in America.
George Floyd.
Yes, George Floyd or whatever. It was such a big word, and every organization was doing this and doing that and doing that. But if you looked at their history, they hadn't done anything. And if we look at it now, if we do the research now, I'm pretty sure most of them have not been
Oh yeah,
effective.
there is a decline now. There is a decline
Exactly. So it's only
initiative.
as effective or as impactful as it has been inclusive, consistent, sustainable, for the employers, especially if there hasn't been a change in the main culture, right? You can put initiatives all you want, and then somebody will point to that initiative as, oh, but we allowed you to eat your Nigerian food or whatever, or whatever it is that they do, right? But that doesn't make sense if, in general, I still can't speak up when someone is being racist to me, or I still don't see the in the room it hasn't changed, the culture hasn't changed, and things like that. So
Okay, I would like Ngozi also have a say in this, talking from the UK perspective. I know you use BAM or globally majority. So is this just going to be a buzzword, or is it impactful when we're talking about employees' well-being and mental health?
Yeah, it's a buzzword. the, the, I'm very realistic about my. I think research says what it says. Research suggests that the issues that we are facing today are the issues that we faced 30 years ago. Meaning that what happened to all these initiatives that occurred? Are they really being effective? That's the question. It sounds all good. We can have nice panels and conversations about this, but underground, are people like us feeling that it's been effective? Maybe it is for some people, but is it really having the impact that we want it to have? So yeah, you can put DIB, was it DEIB on anything, and it sounds good. That's what I said. To me, it's not about the terminology. Terminologies are helpful to understand what they're actually talking about, but the most important thing is that someone like us underground, do they feel that when they apply for their job, are they having in the back of their minds that, oh my gosh, you know what? I don't think I'm good enough for this job because I don't fit the environment that I'm coming to. Until things like that change, until we can see ourselves reflected across all parts of the company, all parts of the organization, all parts of society, then yeah, all of these things, they're not being effective. They're just buzzwords. They're just rhetoric.
Okay, we'll go to the next question, which is what kind of stress management programs exist for employees to introduce in the workplace? Deborah, I would let you take the lead in this.
I don't really understand the question.
Person is asking for stress management programs that could exist for employers to introduce. So, to HR leaders to introduce, for instance, if they're to introduce therapists or they're to introduce counselor programs. Okay, that would be my own take on this. So, what kind of stress management programs do you think can be introduced?
I mean, just to reiterate a lot of the things that we've been discussed, I feel like we've covered the topic already. So really, like I was saying before, you having some type of way to debrief and have an outlet outside of work is important. But at work, as Ngozi was talking about before, having some type of therapy system, or having some type of a go-to person to speak to if you are going through any type of mental health crisis. I think that's probably the best resource any employer or company can put into place to help their employees. And also, as I was saying before, inviting your employees into that conversation to see what resources they need or they feel that they should have in order to, help them through whatever it is that they may be going through. So, like I feel like we've talked about a lot of these things before. I'm gonna keep saying, as we said before, but I'm gonna keep saying that.
You're right.
But I'm sorry.
I think you're so right. We've talked about this. This is almost everything we've talked about.
Right.
Introducing what they have in place, but just the question is just coming from like in the workplace now. We talked about what they could do individually. We talked about what HR and business leaders could also do. But now let's say individually, what can your employees, maybe the person is an HR leader that is thinking about programs that could be introduced and needs a few pointer, and not everyone joined as we started. So I think Ibukulwa wants to say something.
Yeah, yeah, I can add a little bit to that. So I don't know if people are aware that their um insurance provides a lot of additional services that they might not be aware of. So find out from either your HR person or even your EAP. You can sometimes just call them directly to find out what the your insurance covers, because a lot of people don't know that they actually get free therapy, like completely free, free coaching, not just therapists, like actual coaching services. There's free gym membership things. Yeah, so I think, yeah, Derek is also responding to the same thing, right? A lot of organizations actually have that through their HR, through their insurance or EAP programs, but you have to actually call and be like, oh, I need this service. So I'm stressed, I need something. There's also a lot of free app kind situations that I've seen. I know, like, my insurance had offered me something on, again, coaching. They offered me something on, like, dealing with weight. They've offered me something on therapy. All of these things are free services, so I can mention them. Sanvelo is one for stress. Real Appeal is the one for, like, weight management. I don't know why they sent that. And then Able to ABLETO on coaching and as well as therapy. So these are just some that I know, but reach out to your employer, your HR people. They will be able to walk you through.
Ngozi, do you want to add to that? And this is your forte. This is where you specialize on, because I know that you currently offer mental health and consulting and coaching services. So what would you want to say to this?
What was the question? Because she was given names of programs. What was the question that she was addressing?
Yeah, the question is stress management programs that exist, that employers can introduce in the workplace.
Mm. Um, to be honest with you, stress management is a specific issue. So a lot of employees won't provide stress management, well, in the UK, programs. You've got to find that yourself privately. They don't offer that. It's under the umbrella of obviously seeking psychological support. So yeah, we have the NHS free therapy, but of course, there's waiting list if you're in the UK. We have services like myself that are affordable and low cost and culturally sensitive. And there are other organisations in the UK, Mind, Rethink, that you can essentially go to for some sort of therapeutic output. There's therapy groups as well. Therapy groups are really, really good. If you can't afford one-to-one therapy, but you want to feel like you've got a space where you relate with other people as well. And I know they do a lot of employee resource groups in organizations. That's a place that you can have in your organization of Black women, of Black people, where you can kind of talk, and it's a good place to sometimes just rant, right? Just want to rant and talk about the issues in work, and that sometimes is. But I think the stress management program first is identifying your stress and speaking to your employer. Somebody said it in the chat. At the end of the day, they can replace you. Unfortunately, they might even replace you with AI. So the reality is, if you don't take care of your physical health, of your emotional health, of your mental health, nobody else is going to. You said something quite interesting, is that you have to tell them that you're stressed, right? No one's going to say to you, I think you're looking stressed. I think you need support. You've got to let them know. So you got to prioritize your mental well-being, your emotional health. Because at the end of the day, there is no point working for a company 10, 15 years. God forbid, you're no longer able to work. And then that is when you realize how society just abandons people when you're no longer to contribute the way you was once contributing. So it's really important to prioritize your mental health, because you've only got one life, one body, one mind.
Thank you very much. I don't think I have to add to that. So let's go to the next question. Really enjoyed the panel. Thank you, Michael. Thank you for listening. So now the question is, oh, okay, just a question about the phenomenon we see of men experiencing higher level of difficulty with mental health. How do you see this intersecting with DEI? Ngozi, I saw one of your videos about men, black men AIDS. I'm trying to remember the title. I think that was like 4 days ago or 3 weeks ago. I can't remember. 2 weeks ago, yeah. You talked about black men self-hate due to internalized racism. And here is a question again. I want to direct a question to you that is talking about the phenomenon that we see of men experiencing higher levels of difficulty with mental health. So how do you see this intersecting with DEI?
Fantastic question, Michael. I think that's a multifaceted question, right? So I'll only take it on one level, because there's so many levels to talk about. We understand that society has an inscription upon men, generally speaking, of not being able to access their emotions so readily, right? And in different cultures, like, we know in African and Caribbean cultures, and potentially in African American cultures, it's sometimes even more deeper entrenched culturally. So it means that there is a society that, when men are more likely to go through divorces, or they have issues where they no longer see their children, they lose their job, financial issues. We know between the middle ages, they're more likely to complete the S word. They're more likely to self-delete. In America and in the UK, men are at greater, higher rates completing S than women. Sometimes because they're more successful, they use much more effective measures to end their life. Men in general have an interesting dichotomy within the workplace, because although historically leadership positions have been reserved for white men, not all white men are included in that, right? They're not, not all white men. There's class, that's going to be an intersectionality in that, sexual orientation. There's going to be many factors that, I guess, contribute to the multitude of interactions men, black men, Asian men, white men will face within the workplace. So I think men in general have an important part. I guess we like to call you allies. If we're women like to call men allies, especially black women, we call white women allies, right? But there are men in general, particularly black men and men of color, interestingly enough, go through very similar things that black women of color go through. The key difference that I need to make sure and specify, that when companies are looking at race, unfortunately, black women are hidden behind black men. And when companies are looking at gender, black women and women of color are hidden behind white women. That's the key difference. But in terms of the discrimination practices that black women go through, black men also go through. We get told we're the aggressive woman. They get told they're the angry black man. So you've got an interesting, men got an interesting kind of place in the workplace. So Michael, I know Michael, we can talk about that another time, but in another conversation as well, Florence, we can talk about that in real, because black men generally, we need to talk about it, because your mental health is important. I want to say that your mental health is important. It isn't a woman's got more or no. Mental health in general is important, but as Black women, I spoke because I'm a Black woman, but I cannot neglect nor forget that our Black counterparts and men in general also go through their different issues that affect them within the workplace.
Yeah, I promise to have another series of the same topic just for Black men, just for men. Let men also tell, because I think that even because they are being prioritized, there are some marginalizations or some issues that they are also feeling that we are not aware, because we women, we tend to talk and they tend to keep everything bottled it up and do not talk. But I'm also glad that men are beginning to talk these days. If we want to really look into the statistics of it, they are really also beginning to talk. Okay, so I'll go to the next question because of our time. I'll go to the next question, which is how do you navigate into getting better jobs? Okay, I said there was a special request some times ago. Uh, while we answer this question, I'll go to the special request question that was sent to me, specifically that you're talking with people of these industries, and I have this question. The person is probably not online due to work, but sent the question ahead of time. So let's answer this question first. How do you navigate into getting better jobs in the public health sector with a degree in biology and a master's in public health?
Anybody?
Okay, the person is in I think I know this person. So the person is in the US. So I would go to Deborah first, then I'll go to Olubukola.
Honestly, I think the best way is to network. You don't know what type of connections people out there may have, and ultimately, they can plug you in into different opportunities that they may know about. And also looking into entry level positions. I know that having a degree, you might not want to start from the bottom, but sometimes it's essential to start from the bottom and work your way up. So definitely networking and finding entry level positions or positions that align with a lot of the experiences that you have, and also presenting a lot of your transferable skills. You'd be surprised how many skills you actually have to perform well at a specific position, and actually putting those things forward. So you could be from, I don't know, you could be a teacher, and you'd be surprised how well that you would be able to function in an epidemiology role or any type of role in the public health sector. So really just networking, finding how your skills can align with the positions that you're looking into, and creating opportunities for yourself as well, applying to several positions. I think all of those things together will definitely get you to where you want to be.
Okay, Olubukola.
I'll just add to that, look into the biotech world. There are a lot of positions within the biotech industry where your skills will be easily, transferable. Don't be afraid to start small. Don't be afraid to start from the bottom. And lastly, a very unrated part of what we do as public health professionals is bring insights. Started following Ngozi yesterday, and I've seen a lot of her posts. Write about what you know. Write about what you don't know, but you've done a lot of research on. Right. Find ways to put it on there. Partner with people to write publications. And I think that if you do that, you'll start to again make your own name for yourself, and then be able to get people to even want to speak with you and reach out to you. So I think with what Deborah has said, and like I said, biotech industry, there's a lot to do there. And writing, I think you'll be able to get something soon.
Okay. Ngozi, do you want to add to those in case for those in the UK looking out to get into the career path of public health, mental health, or
Okay. I can't talk about public health. That's not my area. Mental health. There's many different pathways. It depends. You want to be a social worker, mental health nurse, psychiatrist, all in between. So I think it's about wanting to know what is it that you want to do, and then kind of start there. Train as you go. See if your employer can, get an entry level job, maybe within the NHS, and then get paid to train. I, other than my university, my BA, I pay for my own master's, I pay for my own doctorate. I don't, because when an employer pays for you in the UK, maybe same in America, you got to give them back your time. So they kind of get you in that clause, and I don't want to be stuck to any company. So consider that. But money is a big issue as well. So one of my friends is doing a kind of psychotherapy training with young people within the NHS. And she was previously a social worker, and she's transitioning into kind of more of a therapeutic role. And I was asking her, what do you want to do beyond this? So that's what I would say in terms of mental health. Send me an email. My team can get back to you, because to become a psychotherapist, similar in America, is a very expensive profession. But we need more people like us in there. But there are ways for the government to pay. It just takes longer. So if you're willing to go through that route, just give them your time, essentially become a slave to them, but get them to pay for your course. You can do that. But yeah, there's so many roles from medicine. If you want to do a 5-year medical degree and then 10 years training, there is that option. There's social work. There's mental health nursing, which is partly paid by the government. So there's different, there's different routes. So it just depends on what route. So Google is your friend. Ask questions, DM us, and I'm sure we'll give our time to answer. So don't be a stranger.
Thank you very much. Thank you very much. In case I didn't get to your question because of our time, I will take a look at it and send them to the host if I cannot personally answer it. I just want to say thank you to the audience. Thank you to our speakers. Also, it's been a long, over budgeted time. But thank you very much. Thank you for your patience. Yeah. So we'll just wrap up the session with I think we can just even skip this one. Advice to leaders. One sentence advice. We've given them a lot of advice. Let's leave leaders alone. Let them go listen to the program, because this is really packed with a lot of information. Personally, I really I learned a lot of things. But I'll just go to additional resources that we have to share with our audience. I will answer this for I will answer this as I can, but you can always connect with all our audience, with our speakers, because I think they are already additional resources themselves and expert in their industry. So you can connect with them on LinkedIn. Their names are the same as it's been spelled. There is no difference. So if you go to Ngozi Cadmus, you'll definitely find there is no two in Ngozi Cadmus. You'll find that there is no two. I really did find that there is no two. So there is no conflict. There is no conflict with that. Ngozi Cadmus, you find out on LinkedIn. Olubukunola, Oyedele too. Your name is not controversial. You definitely find that. Deborah too, is also very. You can see their faces, so you'll be able to recognize. And if you're having difficulty in finding them, you can always send me a message on LinkedIn, Florence Idowu, which is also very easy to find. So find on LinkedIn, or even on our YouTube channel. Send a message to us on YouTube or on LinkedIn, wherever it is, or you go to bavardconsulting.com and send a message to us. I'll be able to connect with you on LinkedIn or wherever way you can. But to our audience, do you have additional resources you'd like to share with the audience?
No, I think, follow me, and then if there's something specific, I can try and help you look for it, or, connect you to the best person that I know. So, yeah.
Deborah?
Just as Olubukunola said, if you have any additional things that you might want to ask, I am more than happy to help you. So just add me on LinkedIn and I will send you those resources.
Ngozi.
Yeah,
I think it's the same. Exactly. I was right. I was definitely right. Let me benefit of doubt. Like, okay, maybe you have other additional resources you wanna share. Okay, here is a fun fact that we're going to close the session with, and that is fun fact about you. I was going to skip this session, but I was like, no, they may want to know something else that is different from you. I know Ngozi said something in our biography, which I think I really want to talk to you about. Maybe have another session with you, Ngozi, on the suicide and depression that you went through. I think it's something that I should create a session with and talk to you about. So let's talk about fun fact. I'll start with Ngozi. Fun fact about you that is not mental health now. Fun fact about you.
Well, this might be TMI, but I'm just gonna say it. Do you know what I mean? Yeah, I don't really wear a bra. That's a fun fact. Yeah, yeah. Let me leave it as that. So depend on the talk. So I will allow them today. So
Okay, I was not expecting that. I'll go to Deborah. Deborah, let's go to fun fact about you.
Fun fact about me, I'm a very big foodie. I love food. I love trying new foods. That's one of the things I do in my free time, just trying different foods from different cultures. I actually have a food page. I have a page dedicated just for food, restaurants
Hmm.
I've been to, and like food that I've made, sharing recipes, things like that. So yeah, I love food, and I would say I'm a food enthusiast.
Okay, to Olubukunola.
Oh, I don't know. I've been thinking about this, but I don't think I can bit the no bra thing. So I don't know. I like to dance. I think that's yeah. I think yeah. That's my fun fact. I like to dance. I like music. I really, really do love music. It's my happy place. Music and cooking. I like to cook. So yeah.
Okay, I can see some appreciations coming in from the audience. I want to also say thank you to you three. It's been an amazing session. There's a lot of appreciation coming in. I can show them all. This is the last one I received. They said it's an insightful session, and I want to give you thanks. Thanks to Ngozi Cadmus. Thanks to Deborah Oluwashina. She missed the age. And thank you also to Dr. Oyedele, and of course to Florence. Oh, thank you very much. Okay, thank you all. It's been a great time. It's been an amazing session. Now I think we lost Dr. Oyedele at that point, but I want to say thank you to you all, to audience. Thank you for staying. To my speakers, I really think I would have another session with you three again. It's a bomb, and it's really inspiring, very educating, and insightful. I really want to say thank you to you, Doris. I would say that comes to the end of today's show. Thank you all for joining us today. My name is still Florence Idowu, on the host for Bavarde Talent Solutions, now Bavarde Consulting and Management, and we bring to you the DEIB Small Talk. We have our sessions every fortnight, Friday. So we talk about the second Friday and the last Friday of the month. You'll find us here on LinkedIn and YouTube, giving you insightful information about DEIB, small talk and talent and business. We have another session coming on the 27th, the last Friday of this month, and I'll bring in an amazing speaker on communication and leadership. And I hope that you would be there same time, same place, same time, 12 p.m. Central Time, 7 p.m. Nigerian time, and we have quite some other times. I can't tell you all the time zone, but I want to say thank you for joining us. Please do not forget to follow us on LinkedIn. Do not forget to hit the subscribe button and the notification bell so that you'll be notified when we go live again. Once again, I want to thank you for joining us, and my name is Florence Ido. Thank you.